across Africa, up to 40 to 60% of people use the drug shops that are the first line of service. They go by different names. They're called medical store, they're called chemical shop, they're called drug operated in Tanzania. I'm going to spend my 10 minutes sharing with you a story and my experience in the ADO program that we have been working with the government of Tanzania. Next slide. Although these shops are very vital for the service, particularly in the rural, they also have a lot of problems. Quite often, the people who are providing service don't have the right skills, they don't have the right knowledge, but also the conditions of the product that are being sold. Some of them are expired, or they're not registered appropriately in that particular country. But also simple things like hygiene, or products that were meant to be available in public facility, they find a way linking into this private sector. So this is the situation. In 2001, Management Science for Health, in collaboration with the government of Tanzania and Ministry of Health, looked at how best we can improve these private sectors. And that's when the collaboration between the private sector and the government to develop this model, which is called the credit card Switzerland. What happened, what happened in Tanzania was you have close to 6,000 existing drug shops today. So the strategy was to transform the existing one, put up an accreditation program that will enable them to meet certain standards. Those standards was based on a package of intervention. There were some business incentives, there's some standard based on the training of the dispensers, people who are providing the service and the owners, consumer education, patients who use the service, and also making sure we increase the number and the number of products that are being sold there. The regulation at the time before we started this program did not allow this drug shop to sell a certain type of product. We worked with the government to expand the list of products, make sure they're able to include many other products. I think I will show that also affect the maternal and child health. Next slide, please. Just to illustrate to you, one of the standards that was a requirement to upgrade and make sure that these shops meet was the premise upgrade, the infrastructure. For the story, I think Peter was showing some of the conditions that we find in many of these settings. Storage is very poor. And for pharmaceutical product and other technologies, you need an optimum condition to be able to store them so that the quality of the product by the time you go to the consumer is assured. So this was one particular standard that was set that owners had to meet. They had to upgrade a particular shop to set the standard. So you can see the one from the left before the shop was upgraded, and the second one on the right after we had gone through the program and upgraded. So that was one particular standard. The same applied for training of the dispenser and the training of the owner. Next slide. Tanzania is a big country, so we in 2003 we did the first pilot in one of the regions in the south, the Rukoba region. After that, expansion has been going on. As we speak, we have nearly covered 50% of the country, but work is still going on. Several partners that are supporting the government of Tanzania, and MSH is providing the technical support. So quite a number of, just one item I always want to emphasize is look at the number of the dispensers that have been trained so far. This is close to 40,000. And this is the first line of your healthcare worker in the rural that have the right skills and knowledge to meet the maternal and child health needs. Next slide. One of the interesting, I would say, interesting development in the ADO program in Tanzania was the number of donors and private organizations that have invested on different aspects of the program. From the government of Tanzania to private foundation like Bill and Melinda Gates Foundation, which funded the first pilot for the proof of concept. USAID were very instrumental in financing the pilot of some of the public health interventions that I'll mention. And we have the Global Fund and the Clinton Foundation and the Rockefeller that are also funding different aspects. For example, it's important, the drug sales are very fragmented. It's difficult to work with them in an easy way. So we are working with them for the Rockefeller grant to form an association, but have a platform that we can easily discuss, but also able to organize the service they're giving. Next slide. This is just to illustrate to you some of the public health interventions that have already been integrated into the adult program. Primarily, the program was meant to increase access to essential medicine, but increasingly, a lot of programs are finding it as a perfect platform to reach maternal children. So we've worked with the Ministry of Health to integrate the child health under the WHO Integrated Management of Child Illness. We recently worked with the Presidential Malaria Initiative to increase the access to artemisinin-based combination with the malaria treatment. And also, we're linking the drug shops, the ADO, to some of the community-based HIV care at the community level. Just to point you some of the products that are already available. We have the malaria medicine. Right on the left side, the new oral rehydration salt for treatment of diarrhea in children, which includes zinc, is now available. We're going to several organizations that make it available there. The treated mosquito net for pregnant mothers and for under 5 children is also available. And also the combined oral contraceptive and condoms. Right now, some organizations are doing some studies and also looking at the best way to introduce misoprostol, which is for the treatment of postpartum hemorrhage. So that should become available, I think, in the near future. Next slide. I want to look also two other interesting dimensions of the adult program. One is the genders. We have close to 90% of the dispenser people are providing the service as women who have been trained and are now at the frontline work. But also 20 to 40% are owner of that business. So there's a lot of entrepreneurship that is going on, but also giving opportunity for women in the rural, not only to provide the service, but also to improve their economic opportunity. Another interesting development that has happened in Tanzania is the National Health Insurance, which is a mandatory health insurance for civil servants, particularly those working in the rural area, has begun to accredit some of the drug shops, the ADO, to provide service to their members. We feel this is a very good development in terms of sustainability for the program, as it enhances the income and the profitability of the shops. Next slide. Next slide. What has happened in Tanzania has generated a lot of interest around the region. As I said, similar countries in Africa have similar structure and more or less similar challenges. We've been working in Uganda with the Ministry of Health to pilot, and I think last year in November we piloted in one district similar program like in Tanzania. Next slide. We've seen interest from Zambia, and right now we're working with the Zambia Ministry of Health and National Malaria Control Program to upgrade, more or less model the program around what we did in Tanzania to increase access to malaria medicine. Next slide. We've seen interest from Liberia also. They have more or less similar structure, and we're working with the National Malaria Control Program and the funding of PMI to increase access to malaria medicine. Next slide. Yeah, so we've seen also interest from Ethiopia and also from South Sudan. So there is a lot of interest in the region based on this model because they said they have a similar structure. I think there's also potential to scale up not only in Tanzania but go beyond in Sub-Saharan Africa. I want to finish by pointing out 2-3 key take-home messages. When done correctly, private-public partnership like what we did in Tanzania have a very strong potential to improve public health. We've seen what we've done for a few years, access to not only essential medicine, but to child health service, to community-based HIV/AIDS, and to malaria. There's a potential for so many other programs that can be increased. The process of transforming the drug shop into something that is standard is a lot of work, but I think it's worth investing, not only in Tanzania, but I think around the many countries that have the same structure. We see a lot of potential for many other intervention, preventive service for maternal child health, to use this platform to reach a lot of rural women and children.